So yeah, as Christine noted, I'm here to talk about cancer financial toxicity and how we can hopefully effectively manage it as much as possible. I'll start with just giving, my intro and understanding of what cancer financial toxicity is, and then kind of move into talking about resources and how we can manage it. Um, so. The standard kind of textbook definition is when you start feeling overwhelmed, stressed out, are making a lot of decisions around your lifestyle and being able to maintain your livelihood because of your cancer diagnosis and the financial strain that that's causing, right? So, long story short, if you get your cancer diagnosis and you're really starting to feel stressed, overwhelmed, strained, you're cutting back on food, any of those things, that's when we really start seeing the financial toxicity strain hit people. However, though, what we really want to make sure, and I'll touch on this in later slides, but what we really want to make sure is that we can catch this part early, right? So this presentation is all going to be centered around what we can do to try to catch that early. Um, when I was, as Christine stated, when I was first diagnosed with cancer in 2006, and even in 2014, when I was given my second diagnosis, the financial side of cancer wasn't a big topic, as some of you may all know, especially when it comes to talking about your lifestyle expenses, your mortgage, your rent, your car payment, your insurance payments. I think you'll get a lot of information around support with medical expenses because that's kind of front and center. However, we really want to be sure that there's information and resources for the community on those lifestyle livelihood expenses as well. Um, so as I was kind of talking about, financial toxicity has a lot of impacts to survivorship. People may not adhere to their treatment plans. You have a lower quality of life. Unfortunately, there is data now out there where um, uh, cancer community members who experience financial toxicity, and if it, like an extreme to an extreme, unfortunately, we are seeing people starting to go bankrupt. And this can even impact survival rates. So it's really important, really key to um, understand your situation, understand if you're feeling stress or strain, emotional distress, anything like that, from the possibility of your cancer diagnosis and how that's impacting your livelihood and your ability to maintain that livelihood. It's going to be super important to really keep those things in mind and check in with yourself, because it's key to get ahead of this is really the main thing. Um, a lot of people will end up, using their savings, borrowing money from friends and families. We've seen people take loans, or like I said, they'll cut back on food, clothing, and leisure activities to help manage and maintain, your livelihood and or manage your medical bill or medical expenses. So those are some key things to keep an eye out on if you're seeing people go through that, or if you yourself are going through that. Definitely be sure to take note of that. And as I talk about later, it's really going to be key to talk to your care team about these things, because we want to be sure that you're not being impacted by the bankruptcy possibility, by not adhering to treatment plans. There's a lot of hidden costs in cancer, a lot of out-of-pocket expensive therapies that may not be covered by insurance, um, transportation and lodging costs, especially if you're having to travel to go get treatment. For example, there's where I live here in Oregon, there are a number of people in central and southern Oregon who have to travel up to Portland, right, to get treatment. And that's a big expense on them. So out-of-pocket expenses are a big key to medical care and cancer care. So those are all things that you kind of have to watch for and be able to manage. And also the number one thing is we don't want people running up credit card bills, right? So that's another issue that we're seeing is people do start facing cancer financial toxicity you're having high out-of-pocket bills. Things are moving really fast after a cancer diagnosis. You're getting a lot of appointments, maybe a lot of extra treatments, maybe extra medication. And typically people, bring out the credit card and start paying for those things. And then unfortunately, before they know it, you're in a dire situation financially. And that's where we start seeing that financial toxicity impact really coming into place after you receive a cancer diagnosis. Um, so I know that's a lot of heavy information to start this out with, but really what we're here to talk about today is not losing hope because there is help. There is help out there. I know it's kind of hard to find it sometimes because there's, the web is infinite and you go and search something on the web and you're going to get a lot of information. So what I really want to do today and what the Atrium Foundation is starting to try to move into is helping provide information upfront for helping people manage financial toxicity after your diagnosis. And that can be as soon as possible. So where to get started? Day one. Day one, if you are a family member or a friend receive a cancer diagnosis, day one, get started with asking for help. A lot of times it could be put on the back burner to ask for help because it's hard. And maybe you're not thinking about it initially, right? A lot of people get their diagnosis and you start thinking initially right away about how am I going to, manage this? How am I going to manage life? How am I going to take care of things? And you just start thinking about all of the factors to manage your health and get through the diagnosis and get through treatment. However, definitely talk about financial toxicity from the outset if you can, and ask for help if you can. The number one thing to do for patients is talking to a patient navigator, talking to a financial navigator. Now, I know depending on the hospital network and how small or big it is, there may not always be a financial navigator, but if there is one, definitely seek a financial navigator out and or the social worker. But number one, talk to your care team. Definitely let them know that this may be something that's impacting the patient or you if you are the patient. And for care team members, highly urge you to try to factor in financial toxicity conversations as early into a diagnosis as possible, so that way we can get ahead of anything that may impact the success of their treatment. Um, One thing I think is pretty widely used. It could be also dependent on the medical network system, but I think this is widely used across the US. There is a cost survey, so it's called the Comprehensive Score for Financial Toxicity. It's a pretty straightforward survey. I think it's like 10 questions. It's one of those bubble forms. I've seen some medical networks, they give it at the same time that they give a patient the "How are you feeling? Are you feeling stressed today?" Paper survey when they come in. But if you're not given that, you can definitely ask your care team for it. This is a good way to get ahead and understand how the person is feeling around their financial situation. I think it asks some basic questions about, are you stressed about managing things financially? Are you having to cut back on food? Are you having to cut back on expenses? And depending on obviously how the patient is answering, that can be your indicator on whether or not they're getting ready to face financial toxicity, or they may be in it already. And then that's the indicator to start putting them in touch with a social worker or a financial navigator, or providing resources or asking for resources. Um, Number two, definitely talk to your family, your partner, your friends, whoever is your network. Um, Talk to them about it. Even if it's not really asking for help or you need them to do anything or provide you anything, I think a lot of times what we've seen is just talking about it and being able to run this by somebody, have somebody there like a buddy to help you work on a budget or help you understand different things. brainstorm with them. It's really going to be key that you talk about it and we help our community talk about it as well. Um, to get it out and not hold it in, it will also help relieve stress. And that's a big factor in our community. And, it's a big factor in cancer diagnoses is helping keep stress down for our patients as much as possible. Um, get ahead of understanding your medical expenses and understand what's due up front and how much they cost. I think a lot of this is what ends up becoming a surprise factor and what really pushes people into financial toxicity is they get a little surprised by what medical expenses are due now versus what can be held off. And so if the patients can understand what medical expenses are due up front, for example, deductibles, co-insurance payments, anything like that, and how much they cost up front, that can really help them just ease some of the stress and reduce the surprise factor. So, if any of you who are in attendance today are current cancer survivors or care team members, please be sure to talk to your care team members about what could be some upcoming medical expenses that are due and how much they are, so that way you can understand that and plan around it. Um, Something else that I've seen in the community that a lot of people try to really do and work with is creating a budget. Or if you already have a budget, start factoring in medical expenses. So that way you can stay on top of the medical expenses in line with your everyday bills. And then that way you can also understand how you need to readjust your budget in line with your medical expenses or your payments in line with your budget, right? So it's really key to understand why those medical expenses are there, when they're due, and how much they cost, so you can start really working them into your budgets and the planning, and then you could get ahead of any of those surprise bills or those really large hefty bills of one, two, three, four, $5,000 and up, right? It's really key to get ahead of that. So um, just to kind of round this slide out, really the thing is start asking for help, start talking to people right away. Care team members, please be sure to urge your patients to ask for help or talk to you as soon as a diagnosis comes. I think financial toxicity, in my personal opinion, can really be I'm going to use reduced. It's a big word, but I think we could really reduce the impacts of cancer financial toxicity if we start talking about it right away, as soon as possible, even if it's the question of, do you guys have any concerns about your financial situation, right? It just gets it out there. We want people to know that there is help. We want people to know that they don't have to handle it on their own, and we don't want people to wait until they're behind and seeking help when it's kind of too late. Okay, so next slide. So I know I talked a lot about talking to your financial patient navigator. I just kind of wanted to dive into some key questions that can be asked and some key things that can really help out with financial toxicity. So number one, as soon as you're diagnosed or even after you're diagnosed, it could be months later, it could be years later, it could be days later. Um, you can start getting ahead of financial toxicity or helping with it by talking to your patient navigator, your social worker, or a financial navigator about payment plans. So definitely be sure to talk to your care team about payment plans or if there's any reduced rates based off of your financial situation. So a lot of times, medical networks or medical networks will reduce rates for medication or certain treatments based off of a person's financial income. So definitely talk to your care team about any services or programs like that. Um, Also remember that you can appeal insurance claims denials. A lot of times, insurance claim denials, They may come out of the gate right away. It could be, who knows why they do it. It could be a practice. It could be maybe they misunderstood the diagnosis. Maybe they didn't have the proper documentation. But please be sure to remember that if you're denied insurance coverage, like if you have insurance coverage, but your claim is denied, you can appeal those things. And your care team should be able to help you work with that. So that is a big key as well. Obviously, there's nonprofits that can help pay medical bills. There's also nonprofits like the Atrium Foundation, which I'll talk about. A lot of nonprofits will also pay for lifestyle expenses, livelihood expenses. So that's, rent, mortgage, car insurance, car payments. They can help with transportation. They can help with food. So there's a lot of services out there that can help with those things. But there are also nonprofits that specifically focus on paying medical bills. Your care team may know about those things as well. And then also something that I think is really cool is there are grants. So also ask your care team about any grants or forgiveness. Okay, because a lot of times there can be a medical expense forgiveness, again, also based off of your income, your annual income, or your financial situation. There can be grants or forgiveness for those things. So, for example, in Texas, nonprofit hospitals are required to provide charity care for patients who have $100,000 or less annual earnings, right? So that is a big thing. So if you're in a nonprofit hospital, definitely talk to your care team about what that nonprofit hospital can provide. There are different situations between for-profit hospitals and nonprofit hospitals. So those are key characteristics to understand on where you're getting your treatment and what their organization status is, because you may be able to get extra care if you're in a nonprofit hospital. Um, and please note that I'm saying all these things in generality. I definitely want to be sure that you speak with your care team about what's best for you. But if there are people who are in dire situations, um, and they really are moving into the stage of going bankrupt, or or really, yeah, I'll just leave it at there. If we have very patients who are very in dire situations, it could be worth talking to your care team about seeking treatment at a nonprofit hospital or a facility that possibly provides reduced payment plans or reduced rates, or who may be able to do more forgiveness. So that's just a general statement. I'm not a doctor, I'm not a care team professional. I just want to put it out there that there are options. And a lot of times when patients are in these situations, they may not think through these types of options. But we're here first and foremost to make sure our cancer community is cared for and that they can come out of cancer with success. So definitely want to be sure just to say, think through the options, talk to your care team, understand your medical practices, organizations, standpoint, and talk to your doctors and your navigators about things like this. Um, so two other things to note. There is a website called dollar4.org. It's a website that kind of uh, it pulls together a lot of information across the states on, like, if there's any free or eligible grants or assistance that's being provided at that state or in the state. So definitely suggest people to bookmark this dollar4.org, and then you can go in there, you can select your state, you can put your income level, you can put um, how much medical bills you owe, or what your current debt is. And then when you hit search, the website will provide you with a list of resources, if there are any resources in that state that could possibly help you out with financial assistance. Um, Also, something I just wanted to note here is there is the No Surprises Act. It is a federal act where emergency services and other care received from out-of-network providers in an in-network setting. So this is very specific. I won't talk all about it, but I just wanted to let people know here to please go and look up your medical bill rights on cms.gov because there's basically a federal legislation that says they can't spring a bill on you that you it can't be out of the blue, it can't be a surprise. There should be ample information, ample notification to you about this bill and plenty of discussion with care teams or the providers on what the cost is. So definitely be sure to check if you're going to an out-of-network provider or an in-network provider, even if you think you're in an in-network setting. And if that's something that you are running into where you have to see out-of-network providers, please be sure to ask them upfront what the cost of their services are, if the insurance will pay for it. There's a key questions to have if you're moving into situations like this because those bills can be significantly higher if you're going to out-of-network providers. So please be sure to ask so that way you understand what those costs could be. Okay, so just kind of recapping on managing your everyday expenses as well. Again, I know I said earlier, stick to a budget. I think this is really key. It's something I kind of wish I had done. I didn't do it. I was diagnosed and then I just ran, right? You get a diagnosis and you just go. And I kind of wish I had taken a step back and said, okay, let me understand what my budget is. Let me understand if I'm going to have to take time off of work, if I'm going to have to take a leave of absence, if I'm going to have to stop working altogether. Really take time for yourself to try to assess what's going on in your world so that way you can plan for it. Things to consider on managing your everyday expenses. You can definitely reach out to your financial companies and request if they have payment options, if there's a way that you can restructure your payment, or if they even have programs for people with medical conditions. They may have those. So definitely think about it. Think about your situation. Think about if that's what would be good for you. I understand some people don't want to let their financial institutions know that they're going through something like this because there is a question on if there's any negative impacts or ramifications. I personally not have heard of anything negative, but that doesn't mean that those things are not out there or not or cannot happen. So definitely do some research before doing that, but it is a consideration. I have seen some of our beneficiaries call and speak to their car lender and tell them like, I was diagnosed with cancer. I'm trying to figure out my medical situation. Do you guys have any programs to help me out? And in this one instance, she didn't know it, but her policy came with a medical a clause that said if she qualified for a medical condition that they would waive like a month or two of her insurance fees, right? So there are some things that can be done. Definitely review your insurance policies or any policy that you have with a financial institution. There may be some clauses in the policies that can help you with that. Um, there are some nonprofit organizations that have good resource pages. I put ours up here. Ours is good. However, I highly suggest Nancy's List. It's nancyslist.org. They have a financial assistance page. I have met the owner of Nancy's List. She's very involved in collecting information for resources for the cancer community because her husband passed away from cancer, and this is how she became involved in the cancer community. She constantly keeps her web pages updated. So go to nancyslist.org. She has a financial assistance page, and then she has all sorts of resources for financial assistance for your home to pet care. So that's a good resource page to go to. And then also atriumfoundation.org. We have a resources page as well, excuse me. And we have collected lists on that site for, different financial assistance different organizations that provide different kinds of financial assistance. So definitely go to either one of those two. Obviously, if you go to Google and type in financial assistance for cancer care, you're going to get a lot of results. So it could be anything for medical to, living expenses. So I suggest if you're going to do Google for anything, please be sure to try to be as specific as possible. So, financial assistance for rent after a cancer diagnosis, financial assistance for my car payment, things like that. The more specific, the better result that you're going to get. Otherwise, if it's just kind of like financial assistance after a cancer diagnosis, you're going to get a lot of information, and sometimes you're going to be weeding through it. It's, I kind of joke, but it's not a joke. It's almost like another full-time job to try to find financial assistance information on the web. So that's why I wanted to point you guys to Nancy's list, because she does a lot of that research. There's a lot of information there. It'll cut down your time on trying to find a list of resources versus going to Google and trying to find one. Um, you can also call 1-800-4-CANCER. It's the National Cancer Institute, so it's the National Cancer Institution's Cancer Information Service line. You can call that 1-800-4-CANCER, and then they'll also be able to help you find resources and possibly referrals. Um, Also, talk to your local care team about any local resources. There are a lot of local resources in areas, especially if you live in a, fairly big city. Um, Things from Meals on Wheels all the way to just local cancer resources that will help with transportation and will help with food. For example, when I lived in Texas, there was an organization called the Breast Cancer Resource Center of Central Texas. And what they did is if you had a breast cancer diagnosis and you needed rides to treatments or to surgeries or whatever you needed rides to, they had people that were on staff to provide rides. So that's why I'm saying it's very important to also ask your care team, or you can also search on the web. It was when I lived in Austin, so I could search on the web, Austin, Texas, cancer resources, or local resources or something like that. And hopefully you can find some local resources that can help with needs. Um, Okay, and kind of rounding it out here, the key is try not to get stressed. I know this is a lot. Care team members, if you're on this call, care team members, please try to help your patients not get too stressed. If you're a patient who's going through cancer right now, please try not to get too stressed. Um, stress is um, Stress is not good for you. It's not good for you. It's not good for anybody, whether you have a cancer diagnosis or not, right? So the key is to really try to keep a hold on how you're feeling, understand how you're feeling. If you're starting to feel stressed, if you're starting to get anxious, if you're starting to really cut back on your everyday needs and your everyday necessities, that's going to be your trigger to please talk to your financial care or your care team about your situation. They're there to help. That's what they're there to do. The social workers, financial navigators, patient navigators. If you don't have one, ask your nurse for one, ask your doctor for one. That way you can alleviate some of that burden and you can start getting help. Um, and also, look for ways to ease the tasks of your daily lives. Okay. I know, speaking from experience, for me, um, getting a cancer diagnosis, I wanted to feel normal. I wanted to do all my normal everyday things. I didn't want to feel like I had cancer or think about having cancer. So I did all my stuff on my own, right? In some cases, I continued to work. Looking back on it, not the best thing. I kind of was stressed out. It did help me not focus on it a little bit, but it added extra stress to my life that I feel like I probably didn't need, especially when I had friends and family who really wanted to help me out, but they didn't know how to help me and they didn't know how to ask what help I needed. So definitely think about it if you're comfortable with it. Talk to your friends, talk to your families. Write down a list of every day or your weekly task, grocery shopping, picking up the kids from school, taking the kids to their activities, picking up your partner from work, right? All of those things that we just think as our everyday little things, those add up when you're going through treatment, especially when your body is trying to heal from chemotherapy or radiation or even immunotherapy. Those things do affect your body. Your body needs time to heal. You need time to rest. So think about how you would feel comfortable if, if you would feel comfortable asking somebody for help to help you with those tasks, even if it's one thing once a week. That way you can have some time to yourself to recoup, take a nap, take a bath, go outside for a walk, sit outside, take some deep breaths, whatever it is you need to take. Um, there's a really cool website called Give in Kind Support. I think it's just giveinkind.com. Yeah, giveinkind.com. So this is a really cool website. It's free for everybody. You don't have to pay anything. If you want to use it, you sign up, and the cancer patient will list out the tasks that they have that they need help with, and then they can invite their friends and family to that task organizer, and then their friends and family can select what they can help with, right? So it's another way to ask for help, that's really low key, really low level, and you don't have to manage a big planner, organizer, or calendar, or Google Calendar, anything like that. You can just go and sign up for this app. You can list the things you need help with. You invite your friends, they sign up, and voila. So just keep in mind those things that can help you, manage the everyday part of this while you're going through cancer. Okay, so I just wanted to talk about a couple more resources that I will be providing Christine and her team that I wanted to give you. I have let me switch over to it. I have a printout, so to speak, of cancer. Oh, let me find it. It kind of hid behind some things. Sorry, I have that's up, and I think I know you guys can see it. I can't see it. That's okay. Anyways, it's a whole list of resources that I compiled, from housing expenses to medical expenses to insurance expenses. It's kind of like the top 3 to 4 nonprofits or organizations that I found, that provide kind of a consistent level of financial assistance for different things. So I'll provide that to Christine and her team. She can share it out. This can be shared out to anybody, doctors' offices, oncology offices, nurses, care navigators, patients. It can be shared out. These are resources that are broadly published across the internet. I was just trying to help do some consolidation and cut down people's time so they're not searching. You can just go to those websites. Um, and then I also have a pamphlet that I will provide Christine and her team as well. It's really kind of the same type of information as that's on that pamphlet and that I talked about today, but it's a consolidated form. It just talks about what is cancer financial toxicity, reminding people to talk to their social worker, to seek support, but it also kind of gives some of those top tips on what to ask for. And it's a reminder on that cost survey. And then there's also some key sites that you can go to look for help. So I will provide those as well. And yeah, that's everything that I had today for just kind of how to manage and how to get ahead of cancer financial toxicity. That was my slides.
Thank you so much, Dorothy. What great information you've compiled, and what a service to the community you're doing. Thank you so much for sharing. So we're open for questions. If anyone has one, you can put it in the chat. You can also, go off of mute if you'd like to ask something too, since we're a smaller group. Anything?
Mhm.
This will be posted up to our blog. Oh, here, Angela, feel free to unmute.
That was so informative, Dorothy. Thank you. Thank you. Thank you. You are just beautiful energy, and you as well, Christine. Um, I am in Canada, and I really wanted to hear this. Um, and I know everybody here is from America, but I wondered, would you offhand know where I would search these same things in Canada?
Mm.
Yeah, that's a great question. I unfortunately do not, but I don't mind poking around a little bit and seeing if I can find something before I give information over to Christine. But yeah, that's a great point.
Thank you.
Yeah,
Thank you. God bless you. Thank you so much, Dorothy.
yeah.
Yeah. Great. And yeah, we will be posting this recording to the website. It takes us about a week or so just to get all the content pieces in order and up. So just be patient there. And yeah, it'll get sent out if you to the registered list of folks with what Dorothy has shown. So any final questions? No? Well, great. Well, thank you all for joining and for being a part of the Cancer Choices community. And if there are ever topics of interest you'd like to see in a webinar, feel free to respond to the registration from this session. And, we're always looking for folks like Dorothy who are really knowledgeable. And if you know of someone, please feel free to share it with us. So yeah, with that, anything to close out, Dorothy?
Nope, that's everything. Please feel free to reach out to myself. My emails in the PowerPoint when Christine shares it. Also, please feel free to go to atriumfoundation.org. If somebody is needing assistance currently, please feel free to email me. My email is on the website, or you can email support@atriumfoundation.org. We do have funding available if anybody needs help currently. The application isn't posted on our website, and it does say that we're not taking applications. We're just kind of filtering through things and doing things a little bit slowly right now, but we do have available funding. If anybody on the call knows of somebody that needs some, please feel free to have them reach out to us on the website. We do have a contact form there. But yes, I'm always here to help and talk to people and share information. Please feel free to reach out. It was my pleasure being here today. So thank you so much for having me.
Thank you for joining us. All right. Have a great day, everyone. Thank you.
Bye bye.
Bye.